It was a very well attended. We got just about all 1,000 tests give out. We had 25 CERT volunteers help us with that, and 10 AACP volunteers. And we had representation from, of course, my office. Cobb Douglas Public Health was there. So it was a great coordinated effort, and we look forward to getting this next 20,000 in. I'm hoping they come in next week. Once they come in, my office will distribute those to the nonprofits, and then work with our commissioners to get the other distribution sites set up so that we can get those, out there to the public as soon as possible. We also worked on the blood drive initiative that you guys discussed last week. I was able to locate all of the blood drive initiatives within the county and share those with Commissioner Cupid. And Ross and I will work to get those in the other commissioners' newsletters as well, so we can get that information spread out to the public. We have reached out to the department that handles the blood drives within the county, and we're looking forward to setting up a date where we can sponsor an event, and we'll open that up to the public, of course, and all county employees. So we do look forward to having that soon to help with the initiative. And that's about it.
Thank you, Cassie. We appreciate that update. Dr. Chapman, I'll now turn things over to you.
Good morning to everyone. We would continue to like to start with an encouragement to please get vaccinated, including getting your booster shot. We have continued to see the largest percentage of our admissions within our hospitals, particularly at Kennestone and Cobb, but also across Wellstar, to be those who are unvaccinated. Those are the ones who are occupying the highest level acuity, which being in our critical care units. We continue to stay ready. Again, on behalf of my team, I continue to reiterate the level of resiliency. Every surge, we cross our fingers and our toes and do all the things that we possibly can to hope that this is the last surge. But I just want to commend the team for continuing to hang in there. I'll start with also, like I do normally, is to give you some numbers. I think the data sort of speaks for itself. We start today with 579 COVID patients within our hospitals across the system. And that number, as compared to last week we had 686. So good news story, but surely also a reminder that we still have a ways to go. But just for everyone on the line, we also have been as high as 819 in our health system. So just a good visual in terms of the team. 69% of the patients are unvaccinated. So again, the unvaccinated continue to be the highest number of patients who are being hospitalized. We have 97 COVID patients in our ICU. Last week, though, good news, we had 118. So we have seen a slight decrease, but our ICUs are still continuing to be very, very busy. And I know Dr. Havlick in a few minutes is going to talk from a physician clinical perspective, and he'll reiterate how that looks within our hospital spaces. We had last week, we had 60 ventilators in use. This week we have 65. So again, connecting the dots in terms of we are seeing a decrease in the total number of COVID patients, but when the patients are sick, they're very, very sick, which again changes all of the plans of care. Everything from, how many resources it requires to take care of each individual patient, which have been the most taxing on our teams within our hospital walls. We always talk about visitation. We have had some new processes by which, with Wellstar was one of the hospitals that required our team members to be vaccinated. And so part of that is this morning we talked about loosening some of our visitation restrictions. So that will be a good news story. We try to balance that again with our numbers and again, the nuances that are happening behind those walls. But I also want to reiterate that even in the midst of our visitation policies and our trying to restrict the number of people coming in and out of the setting, we have always tried to work individually with families to be flexible. There are oftentimes nuances where we have patients who perhaps cannot communicate for themselves, especially in the midst of death and dying. We have continued to be flexible. So if you hear of examples where thus that we need to again intervene, please continue to share those, and thank you for your proactiveness in the past. Keystone numbers within our hospital, those numbers are continuing to go down. Cobb usually have about half of the Keystone volume. And again, it's reflected in the overall numbers. I will tell you that we are also focusing on, as the COVID numbers increase, they are taking up additional beds and staffing to care for other patients who require procedures and surgeries. We have begun to see our physicians working with their patients directly to begin to reschedule some of those delayed procedures and surgeries. So if you know community members or yourself who you have been subjected to perhaps a delay, then we are encouraging you to work with your physicians because they're working with our individual hospitals to make sure, again, that we can provide that care safely and high quality as we pride ourselves in. So again, on behalf of the Wellstar team, Candace Saunders, our CEO, and all of our team, including those who are on the line with us today, we appreciate the continued collaboration. And with that, I am going to punt to Dr. Mimar.
Thank you, Mary. So when we're looking at our cases from last night, we seem to kind of hit a plateau, a high plateau in the number of cases that we're seeing. So we have 1,647 cases per 100,000 that was seen over the 2 weeks previously. And so remember, we're trying to get down below 100. So, we've come down a long way, but we're still very, very high and have a lot of transmission happening in the community. When we're looking at our PCR rates, of positivity that are coming back, we're still very high at 24%, so 24.4% positivity on PCRs as well. And so once again, we want that number under 5%. So still seeing extremely high rates of transmission in the community right now, and still all due to Omicron. When we're looking at our vaccination rates in Cobb County, we've done fairly well. And so we've been above the state average when we look at vaccinations. We're at 65% for first doses and 59% for fully vaccinated. What's a little concerning to me is the booster rate, which is at 24%. And I'm going to share with you why boostering is so important, and I'm sure the hospital system will agree as well. We took a look at some of the breakthrough cases that we've had in Cobb County. And so of the cases, so we looked over January of last year to January 1st to January 26th of this year. And we had over 116,000 COVID cases during that time. What we saw was that over 30,000 of those cases were considered to be breakthroughs through vaccination. And so we had, a considerable number of cases that have broken through the vaccines. Now, you may be asking yourself, how important is that? And why get vaccinated if you're going to get breakthroughs? Dr. Chapman told you a little bit about the hospitalizations, but we looked at the deaths as well. We had 760 deaths during that time of January 1st of 2021 and January 26th of 22. And what we saw in those deaths was 760 deaths, but we had 91 deaths that broke through that had been vaccinated. So, and I'll break that down a little bit. We only had 2 that had gotten the Johnson & Johnson vaccine, but remember, we had very few people that actually got the Johnson & Johnson vaccine. Most got the two-dose mRNA vaccine. Of the 2-dose folks that got the vaccine, we had 85 people that had died from COVID. And if you received your booster shot, we had only 4 people that died that had gotten their booster. And so that was, 0.52% of the folks the deaths that we had seen. So that's very important. When we look at the folks that had died who had gotten their vaccinations, it was definitely an age-related type of thing. And so we saw people in their 60s, and then when you got to the 80s, you definitely saw more people that succumbed to COVID. We looked at race a little bit too, and what we saw was that we broke this down by case rate to make it a little bit apples to apples. And so 27 per 100,000 of the folks that had died were white, and then 19 per 100,000 were considered Black, and then 3 per 100,000 were Asian. And so we watched that because of our disparities as well to make sure that we're getting to where we need to go. The 4 deaths that had boosters, what we know is a lot of them had a lot of medical issues, and the ages that we had were 68, 82, 83, and 86. So definitely in the older age range. This is extremely important for protecting everybody is to get those shots. I wanted to talk a little bit about BA2. So that is the offshoot of the Omicron variant, the first one. And so it is currently detected in 40 countries right now, including the United States. This one has a 20 mutation difference from Omicron, which is BA1. What we're seeing is that in countries that are dealing with it right now, like Denmark, it is displacing Omicron there. It is thought to be still a less severe form of the COVID-19. But they are still having hospitalizations, but they're not having any differences in hospitalization. So people are still being hospitalized, and it's still very, very infectious. The World Health Organization has named it a variant of interest, and so it's not quite up there yet of concerns, but we are watching it very, very closely to see what happens to the United States. There's some questions about therapeutics and vaccines, and it is thought that there, may be some similar resistance to therapeutics like Omicron has, but vaccines should hold up the same as Omicron. But, all of this is being watched very carefully, and we'll get more information as it comes out. So my recommendations to everybody is, as we see our cases come down and hospitalizations come down, really we need to use this time to go ahead and get boosted up. It's very, very important to get your boosters and make sure you wear well-fitted masks. We're seeing time and time again that this is folks that are getting unvaccinated, but that are getting very, very sick. But now we are seeing more people that have gotten their vaccine series, and that booster helps tremendously. So please get that done when you can. Thank you.
Now we'll punt to Dr. Havlick, and he will give us a clinical update as well. Good morning, Dr. Havlick.
Good morning. Can you hear me okay?
We can.
Great. Good morning to everyone. Just want to reiterate what Dr. Memark has said in terms of the acuity of disease we're seeing. And I also want to congratulate her. I got to see her interview from, I think, yesterday, and she did a wonderful job of, I think, getting the message out. So for those of you who haven't had a chance to see it, I would encourage you to watch her interview. We continue to see very critically ill patients with many needs that has been, and also the challenges for patients, family, and our care teams, because we've also had care team members that have been sick, and that's limited the number of staff, and that's made it tough for us as well. All the resources of the systems have helped us balance the load. We've gone into a nationwide shortage of nurses, and this has been an ongoing concern on a daily basis. Our high capacity numbers mean that if you have a medical condition that's not COVID, such as a heart attack, stroke, COVID, or trauma, your care could be delayed. I had one patient this week that I visited for 4 days in the emergency room on a ventilator because we did not have enough room in the ICU at the hospital I'm working at. I'm still seeing COVID patients who require care for months. I have one patient, I'll let you know, the patient was hospitalized at the end of August. It is now the end of January, and he's been in the ICU that entire time. And most of these patients are unvaccinated, as this gentleman was. And the fact is that we have no way to predict who's going to have this severe outcome. So that's the importance of getting vaccinated. I'm also seeing patients that really are in the hospital for other reasons. I'm already working through my patients that I'm seeing today, and I have an elderly gentleman who has Staph aureus bacteremia, but by the way, he also has COVID. So we're seeing a combination of those problems. This gentleman is vaccinated and probably doesn't really have, intense COVID problems, more of the other, the bacteremias. So it's just a variation. And so we have a lot to deal with some of these patients. Our goal is to provide timely, high quality care to our patients and those with COVID and other medical conditions. And so it's been especially challenging for us. I just want to reiterate to get everyone fully vaccinated for COVID-19 vaccine, as Dr. Memark had suggested, and to get the boosters when eligible. Practice the 3 W's, which are wear a mask, wash your hands, watch your distance, and preferably avoid crowds. Please make sure your mask has multiple layers or an N95 and it fits snugly on your face. We found more recently with the COVID Omicron variant that the cloth masks are of not as much as value as they originally thought to be in the early parts of the pandemic. If you are having issues, that get to the most appropriate medical facility to get care. If it is mild symptoms and you feel you can just contact your primary care physician, please do that. If you are concerned that it's a little more than that, but not sure that you need to go to the emergency room, at least go to an urgent care. We have multiple ones across the Wellstar system that can help you. And if you know you are having breathing problems, please go directly to the emergency room, because that is the best place to have evaluation. And more likely, if we're going to do anything that would require admission, it speeds up the process by getting straight there. Early diagnosis is really the best. We've learned this from the very early days. And now as we come to have more therapies, we know these therapies only work because we are trying to stop the virus from replicating. The drugs like remdesivir and now the 2 oral agents, one from Pfizer, Paxlovid, and the one from Merck, all are antivirals, and they stop the replication of the virus. The virus replication is just for a few, like 7 to 8 to 10 days in most patients. We don't know and don't have a good way to measure that, but we know from studies done that if you're going to use those drugs, they work best when given in the very front part of the infection. And if you're going to use the monoclonal antibodies for the same reason. We still encourage people to follow the CDC guidelines for quarantine when exposed. Isolation for COVID positive patients continues. We're using still, if a minimum of 5 days, provided the symptoms, markedly improve and there's no fever, for 24 hours off Tylenol. And lastly, there's a big issue with blood product shortage. And this has been a crisis across the United States. The American Red Cross has announced this week the nation is facing the worst blood shortage in more than a decade. It's due to fewer blood drives during the pandemic. And so this is an essential problem for our patients who need blood transfusions in the hospital, either for trauma, critical illness, or have other anemia or other bleeding needs and so we need to get donations. And so there's a plea for that. So if you are healthy and feel you can contribute to that, we encourage you to make an appointment to give blood or platelets so that these products can be used for our patients. I'll leave it. Do we want to offer a chance for questions, or is that going to be later?
I think we'll move to Lisa. She and Stephen have agreed to partner at the hip. And so, Lisa, I'll punt to you.
Thank you.
Thank you,
Thank you so much. And just a reminder, coming off of Dr. Havlick and Dr. Memark, just a reminder for everybody, we want folks that are 5 and above to get vaccinated, and those 12 and above to go ahead and get boosted. And so we want to make sure that folks know that there's a really high volume of our residents who are eligible to get vaccinated, and the availability is extremely easy these days. So let me start with that, and then I want to talk, just to thank all of our partners. You know, one of the benefits I think coming out of this pandemic is the strength of some of the partnerships that have been developed during the pandemic. I cannot speak more highly of our partnership with the county and with Wellstar and with some of our other groups like KSU and folks in the community who are doing some of the vaccination efforts. So just thank you so much for that. We continue with our mass testing sites around the county. So we have one up at our KSU Brand Smart location, at the Wellstar East Cobb site at Jim Miller Park, and also down at the Epicenter. Those are running 5 to 7 days a week still. I will tell you that demand has reduced dramatically over the last week and a half. We're running under 100 tests a day at some of our outreach locations, and on a weekday, and then on the weekends, it's under about 75 a day. Jim Miller Park's a little higher. We're running about 200 or so tests there at that location a day. And so we still see the demand, but it has dramatically reduced, and there's no wait time. So if folks do need to get tested, these are great sites to be able to swing in, get tested. We're also seeing the resulting time come back down to a more normal resulting time. I did want to let the group know that we're making a change because of that decreased demand. We're making a change at our KSU Brand Smart location effective on Monday. We'll be moving that location to Monday through Friday, 8 a.m. to 2 p.m., and then Saturdays, 12 to 4. And the reason is that, one, demand has reduced, but the other is that helps us reduce some of the cost of overtime police to be able to manage that site. And just a special shout out to KSU. They've provided the site and provided on the on-duty police officers that are on the KSU force. So we really appreciate them and our LTS lab partners. So testing continues. It's available. Cassie already mentioned about the rapid testing, so I won't go over that. Wanted to hit the highlight about vaccinations, that those are still so readily available at any of our partner pharmacies, urgent care centers, public health centers. All of these, it's easy to get vaccinated. We're also continuing to do about 5 to 6 outreach events a week out around Cobb County at different locations. So just check the Cobb and Douglas Public Health website for more locations. And I really appreciate Stephen's team and the Wellstar team helping us out with some of those outreach vaccination efforts. I've been getting a couple of calls this week for homebound vaccinations for boosters for seniors, and just wanted to remind everybody that we're continuing to do that. We have a great system where either through our website or the DPH state website, you can register for a homebound vaccination. It comes right to the district that is that address. And then we've got a system in place to link here in Cobb County with Pools Pharmacy to be able to offer those homebound vaccinations for either seniors or disabled individuals who can't get out to one of our other outreach locations or to one of our clinics. Third, I wanted to give you an update about the community health worker program. I think I mentioned to you that we've received some very significant funding from the CDC and Georgia Department of Public Health to offer community health workers to help link residents on a very grassroots level, link those residents to the care that they need, whether that's testing or vaccination or homebound or other services, healthcare services. So we are doing 2 things. We're doing a partnership with Morehouse School of Medicine, and we've made some real nice progress this past week with that behind the scenes contract and their process for hiring and training community health workers. We still expect that those folks will be on the ground sometime February. We're still keeping our fingers crossed. It will depend on the hiring process with Morehouse. And then Jasmine McLeod with Public Health, who's leading that effort, is also going to be working with some of our key partners to see if we can do some stipends or some mini grants out to them to have community health workers that they may employ at a church or in a school or something like that, that would work with those particular populations to also link them to care. So more to come on that, but I'm excited about it. We also have just received funding from Department of Public Health to try out one community health worker that's going to be focused on chronic diseases. So not just COVID, but really trying to link folks to care who may be suffering from heart disease and diabetes and need some other care besides COVID related care. So we're hoping that that will blossom in the next month. And then that's a 2-year commitment that we have from DPH. And then lastly, I just wanted to remind everybody of the really robust project that we have going on with Cobb County Medical Examiner's Office through a grant from the Council of State and Territorial Epidemiologists. This is a national grant that the team pursued and was awarded about $300,000 to be able to do protocols to investigate, identify and investigate unexplained respiratory deaths outside of the healthcare settings. And so that team of epidemiologists in public health and also the Cobb County Medical Examiner's Office has just done such a tremendous job on that project that has national implications, and that they've been awarded another $200,000 to continue what they've been doing into the coming year. So I think that has not only benefited our residents to assure really accurate identification of manner of death or cause of death, but also to have far-reaching national implications of how those protocols should work. So, and I'll stop there.
Very good. Thank you, Lisa. I'll now put to Brandon for a legislative update from Wellstar. Brandon, good morning.
Thank you, Mary, and thank you, Chairwoman Cupid and the whole team. Wanted to share that Wellstar leadership and our government relations team met with the Department of Community Health Commissioner Kaylee Noggle this week, and we remain in constant communications with them and also the Office of Governor Brian Kemp to keep them apprised of our needs, our issues, and the conditions in our healthcare facilities. So we certainly want to thank our partners at the state and also the county to say how important each of you are to us. Also, we'd like to commend Speaker David Ralston on introducing his mental health bill, House Bill 1013, introduced this past Wednesday. It's a bipartisan bill meant to address the fact that Georgia ranks 48th in the nation among states as it relates to treatments for those with behavioral health needs. So it's been recognized that we got a long way to go. And fortunately, the speaker has said recently, time and again, that this is his absolute #1 priority. So Wellstar is at the table for that, and wanted to talk a little bit about that, and also to commend State Representative Eric Allen from Smyrna on his House Bill 1003. As we all know, negotiations remain largely stalled with United Healthcare and Wellstar, despite our best efforts to sign a fair contract. The same thing is occurring with Anthem, Blue Cross, and Northside. So it's a big problem. Eric's legislation would prohibit health plans who are not negotiating with their hospital partners in good faith from bidding on the state's health benefit plan. That's business that they rely on to boost their profits. So there's some teeth in the bill. We appreciate him bringing it forward. The bill currently resides in the House Insurance Committee, chaired by Representative Eddie Lumsden from Rome. Also, a quick mention of House Bill 961 by State Representative Chuck Estration. It deals with apportionment of damages in court cases. I'd like to talk with you offline if you want to learn a little bit more about that bill, but it's important to not only the hospitals in the state, but all businesses. It passed unanimously through the House Judiciary Committee this week, and now sits in House Rules Committee, where it awaits to be scheduled for a full floor debate in the House. Another issue that is upon us is once again visitation policy legislation. State Representative Ed Setzler from Packworth introduced a bill last year that would have allowed the state legislators to write hospital visitation policy. And we know that the author's heart is in the right place here. Wellstar and other hospitals in the state absolutely recognize, like Mary said earlier, the importance of loved ones having the ability to visit our patients in the hospital. And we're doing so, and we have been doing everything in our power to allow for safe visitation. Ed's bill unfortunately contains some language having to do with mandating what he calls a legal representative to be inside the hospital making decisions on behalf of patients. And that would conflict with years of work that the legislature has done involving advanced directives and a whole host of other state and federal regulations that we are made to abide by. So it's our hope this year that Representative Setzler will work with Wellstar and the hospital industry to find a reasonable compromise if he remains intent on pressing for legislation that would again allow the legislature to write policies for healthcare professionals. Another issue that's on the forefront is vaccine mandate legislation that would prohibit employers and other organizations like schools from having reasonable vaccine requirements that they've had in place literally for decades and decades. It's being brought forward by several Republican state legislators in the Senate. It's been coined by some in the healthcare community as the Bring Back Polio bill. And while that may sound funny, it's really not a laughing matter. It's really serious, and it's startling, and it should be surprising to anybody with their head screwed on straight. So we're working with legislators to provide information about why vaccines of all kinds are so important to our state's public health standing. Pleased to report that the nurse workforce shortage is being addressed this year in the state legislature. It's been recognized that a tremendous amount of work is needed to improve the training pipeline that's required to train healthcare workers and get them into our facilities to take care of our patients. Talking with our nurse leader, Jill Caseworth, and Natalie Jones on the best ways to ask the legislators to help us. I know the Wellstar Foundation is also involved in work to address workforce shortage issues, and we'll be in touch with this group to explore ways that we can all collaborate with you on these initiatives. I would like to just briefly kick it over to Abigail Thompson to provide a short update on federal efforts to also address the nurse workforce shortage issue.
Thank you. Yes, at the federal level, there has been a Dear Colleague letter that was circulating in the House addressed to President Biden's administration, encouraging him to direct consumer protection agencies to investigate possibly anti-competitive practices of these nurse staffing agencies, possibly artificially inflating the cost of nurse contract care. So this is an issue that we know hospitals across the country are facing. And when you compare pre-pandemic contract nursing costs compared to current, there is just usually hundreds of percentage increase in this expense for hospitals. So at the end of the day, this business model is not sustainable, and hospitals are somewhat in crisis mode trying to get the staff they need to care for these patients. And so we're relying on these staffing agencies to help fill those gaps. But if they are artificially inflating prices to seize on profits during this crisis, that is not helpful to hospitals and really driving up the cost of this expense. So we hope that President Biden will direct these consumer protection agencies to look closer into this and to spotlight this national issue for the healthcare industry. So more to come on that. But we are very appreciative to the members of the Georgia delegation. We had a lot of co-signers join that letter, both Republican and Democrats. So we appreciate their support of hospitals and looking into this critical matter. And that concludes my update, and I will kick it back over to Madam Chair Cupid to close us out.
Before we punt back to you, Chairwoman Cupid, I wanted to fill in the blank for a couple of things, that are numbers that I didn't give you. The Kennestone, currently we're at 209, and a week ago we were at 213. And at the Cobb Hospital, our numbers are 64. And a week ago we were actually at 104. So they've seen a really good decrease And then I wanted to also put some numbers to context of what Abigail just talked about. Prior to the pandemic, I have always worked with agencies as a complement to our core staff. And contractually, we were paying, $75 to $85 an hour. And during the pandemic, those rates were as high as $200 an hour. And then the other nuance is that we had high numbers of staff who had flexibility in their work actually leave our organization and apply to the agencies and work within the Atlanta market. So for a period of time, we would see nurses at Kennestone from Emory and vice versa. So again, no good deed goes unpunished. I know that the agencies, their intent is to help us with staffing, but it really did, as Abigail said, create a different level of complexity and challenge for us that we feel like is just not sustainable. And then the last thing I'll mention in terms of that, Brandon talked about the visitation. When we talk with the legislator along with Brandon, we try to put an operational overview on what it would take to do what the bill is asking. And as we are looking to balance our visitation, during this last surge, we had a high number of team members who in boluses were out with the COVID. And so having the risk of bringing, the virus within the healthcare setting and taking out entire teams of nursing and clinical people would put our care at risk in terms of how we implement that care. So I thought I'd just add those two sort of operational complements to the amazing content that Abigail and Brandon shared with the group. And with that, I'll come back to you, and that represents our update for this week.
Thank you, all of you, for this quite robust update and giving us a lot of context to view the impact of the pandemic in, all the way from what's going on the ground in the hospitals, from a person perspective to a nursing perspective. And I appreciate even hearing things going on in the community as far as testing, but also the legislative matters that are being considered here locally at the state and also at the federal level. With that, we have a number of people who have joined this Zoom meeting. As usual, I will open it up to see if anyone has any questions.
I have a question, Madam Chair, regarding the staffing agencies and the increase in pay. And I'm wondering if any of that has been driven by the nurses and just wanting to increase their pay and putting themselves in those situations, in the dire situations at the hospital. I'm just wondering if the ask is also driven by the request of the nurses. I was just curious.
I'll be happy to take that one. We always are, as hospitals, looking at, our market rates for compensation. And we try to stay within a certain percentage of the market. And in the local Atlanta area, our competition or our comparison groups are the Piedmonts, the Northsides, the large health systems. I would say that the nurses did not drive the rates, but they surely did take advantage of the rates. And also in the news, there is, publications and communication that's out that, I've read as well that says from some of the clinical staff that say, you see, this is really how much, we are worth, and this is how much hospitals should pay us. Again, I believe, as Brandon alluded to, the model is not sustainable because at that rate, that is not really market rates. So once the pandemic goes away and the agencies, and we saw this in the prior surges, the agencies are not able to get the individuals that they've hired the amount of hours they need. Typically, they will go back to core staffing in an organization. And when they do, they go back to the core staffing rates that are market driven.
Yes.
Thank you for that question.
Thank you. Thank you for the answer. Thanks.
I'm sure.
Alderman Cupid, I
Yes,
have a
ma'am.
question for maybe Dr. Havlick or Dr. Memark or Dr. Chapman. I'm getting quite a few calls this past week or so about infusion therapies to treat the Omicron virus. And a lot of these seem to be non-monoclonal antibody, they're just, I think they're just electrolyte and vitamin infusions. Can you talk a little bit about how that works and what's best for patients and what they should do to make sure that they're not thinking they're getting some approved treatment and then they're not?
Dr. Havlick, you want to take that one?
Yeah. So can I just say that, first of all, there's a lot of nuances to this, so it's kind of a hard question to answer very easily. But the main treatments have now been for the hospitalized patients to receive IV remdesivir. We've struggled because of the nursing and staffing shortage to provide an outpatient remdesivir program as an option. We've looked at that and just haven't had the capacity to really accommodate it. And the reason is you have to give the drug for 3 days in a row at a minimum for mild cases. And then the monoclonal antibodies are another IV product that is out. And the first two that were available were the Regeneron and the Lilly products. They have shown to not really be effective in Omicron. And so a new one by GSK called Somatrab has been released. We are getting our supply from the state government. And, you know, the numbers that we got, I know in the first weeks were only like about 60 doses for an entire 11 hospital system. So if you kind of do the math, you'd see 6 or 7 doses per hospital. So very limited supply. That supply is starting to increase, and we had to put in tiering for the most sickest at-risk patients that would be appropriate for that. And that's a whole nother discussion, but we are trying to open it up as those drugs become available. Lastly is the oral agents are available, and they're given out through the designated pharmacies that state has. There's about 50 plus of these. There's a map that's available and has been out for several weeks. And so our providers, when they have patients that are appropriate, they are using, and the main drug there is the Paxlovid, the Pfizer drug, and they are giving prescriptions for that out. And then the only hard part is there are only these certain pharmacies that have it. If their supply is out, then you have to go to another pharmacy on the list. And it's not always clear who has it, who doesn't have it on a given daily basis, depending on their supply. And so, and lastly, about IV fluids and hydration, you know, if someone is hydrated, then they need to come in and be seen at urgent cares or the emergency room. Most doctors' offices usually are not set up to give IV fluids to these patients. So we have some capacity to do that, I think. And I'll let Mary, you know, if she wants to add any other comments on that. But for the most part, that usually is not something that we routinely do for most patients. We encourage just, you know, good oral hydration if need be, but if they have nausea, vomiting, and that's a problem, then that would be the appropriate one to come to either urgent care or the emergency room. Mary, do you want to add any comments?
No, I think you answered, you included what I would say. Thank you for that.
Thanks.
Are there any other questions? I had a couple. Just last evening, I was at a community event and someone was stating that there is still a very long line for testing in East Cobb. And I don't know if that's come to your attention, Lisa, or anyone at Wellstar. They made it seem as if we're still, and I see you, Dr. Memark. I don't know if you've heard that.
Well, you know, actually, we received an email today about some isolated spots. So I don't know if that is one of the our sites or not. But the one thing that is being encouraged is that everybody try to register ahead of time. They see that it's slowing down the lines when you don't register ahead of time because you have to collect all this information. So please, whatever site that you go to, please go online if you can and register. We have had some reports of some folks that having some trouble with the technology on it, and that's completely appropriate to come and they'll help you. But if you can, please register ahead of time.
Okay, thank you. And then, Brandon, I don't know if you're still here. I was taking notes as you were talking about some of the things going on at the state and federal government, and you spoke about a bill that pertains to court cases, and you said you may need to speak about that offline. I'm sorry, I missed that.
Yes, ma'am. That's House Bill 961.
Mm-hmm.
The Georgia Supreme Court made a decision over the summer to revisit Senate Bill 3, a civil justice reform bill that passed back in 2005. And careful reading of that statute, they determined that defendants, you couldn't bring multiple defendants in cases. So if you had an issue, for instance, Piedmont recently had a driver unfortunately drive into their emergency department. And, in a lot of cases like that, there's thought to be apportioned in order to apportion damages. And what the ruling said this summer was only one party could be considered at fault. And because of that, what we're seeing is attorneys going after the defendant with the deepest purse strings. And in Piedmont's case, of course, it was Piedmont. While there was argument to be made that there were damages from several different parties. Same thing's happening at Home Depot and CVS when things occur on their property. And so there's a united coalition of businesses and other organizations, including the Georgia Trial Lawyers Association, who has come together. It's rare to get all those groups aligned, especially this early in the session, to form a coalition to just rectify that situation and change a couple of sentences in the statute to reflect what the intent of the actual bill from 2005 was.
Okay. Thank you. Appreciate that.
Absolutely.
I appreciate you discussing some of the impacts as it pertains to what's going on with nursing and the pay. I know you spoke about that from just, I think, a pay perspective, but I can only imagine what the impact is and morale to be working with someone who's leaving, coming back, and how that impacts the organization. And so, COVID has already been a challenge, and there are all of these other impacts that I think, the public at large is just unaware of, to the strength of our hospital system, which is part of the reason why I continue to keep our emergency order in place. I heard someone on NPR share that even though the Omicron variant is a milder impact to the public, that doesn't mean that the impact is mild. And the impact is not just on health, but the impact is on our health system. And it just captured that so well. And to me, our health system is integral to having a strong, well-run county. And so I will continue to do what we can to recognize that through our actions, whether that be through emergency order or by us limiting large gatherings here. And again, a lot of that's in the county manager's purview, but we have that language encouraged in our emergency order to limit large gathering, and she has fortunately been responsive to that. And we want to see these numbers come down like everyone else. And I lean on the people that are on this call to help me do the right thing for Cobb County. I'm not the medical expert. I'm not a subject matter expert. This is why we have this meeting, so I and others can hear from you. So if you have any advisement where, as a leader of this county, I could be helping you in keeping Cobb County healthy and safe, please let me know. And right now, for everything that I've heard of since I've been here, is that we are way above the COVID transmission rate of 100 out of 100,000, which is that threshold for being high transmission. So when I see us at the numbers where we are, that prompts me to consider emergency order. When I see the positivity numbers where we are at, over 20%, and we should be at 5%, that, pushes me to want to do something more about it. When I hear we have a severe overcrowding in our hospital system, again, these are points that I'm looking at when I consider the emergency order. And I wanted you to know that I am relying on you. I'm not making up, these emergency orders on my own. The data that you share with me during the week and what you share in these calls directly impact how I respond as a county. And we're receiving a lot of pressure to open things back up. We've had a big fallout at our aquatic centers, where in the large gatherings in our facilities caused concern for staff. And so there was a limitation on how many people could gather there. But for our swim meets, there are a lot of people who come to our facilities who may be unmasked or who are in close proximity. And the public was just frustrated that we were not allowing everyone to come in and observe these meets, and that some swimmers had to leave after their events. And that also caused a shakeup on our staff. We had the person who's over aquatic centers leave the county, actually, as a result of this. So, the decisions I'm making to help support the health system here in county are having an impact on the public. A lot of people who are challenged and trying to comprehend why we're making these decisions. And so again, I just can't emphasize enough, I'm trying to do what's best to consider Cobb County as a whole, and that what you share with me, and I'm relying on that when I make these decisions. Yeah.
Well, Madam Chair, thank you for the leadership that you continue to demonstrate on a daily basis. I know you're working day and night, and we're all struggling to, make decisions on safety protocols during these times of change and uncertainty. But your leadership is greatly appreciated, and we can't thank you enough for allowing us to be with you and your team on these updates.
And I always try to respond with the sort of drawn operational, listening to you talk, it really harkens us back to, when Wellstar, we were one of the first health systems within this, in this area to mandate the vaccine. And so, there were people on the side of that, they rushed to get it. There were others, and we lost team members based upon their, personal values and views. And it is tough. It is, tough to balance making the right decision. And, Candace Saunders, our CEO, said, she lost a lot of sleep in getting to that point. But I think we're doing the right thing, and, eventually we'll come out on the other side if we stay fast to, what we're doing.
Thank you. I agree. So I can't underscore enough how valuable these meetings are. I want to thank each and every one of you for what you do to prepare for these meetings, and for what you're doing each and every day to help get our numbers down, whether you're on the front lines, in our hospitals, whether you're fighting for keeping us safe, the legislative halls, or for those in the public with Cobb Douglas Public Health out there vaccinating the public and getting us tested, that everyone's efforts are making a difference, and I appreciate you. And again, please keep in mind and keep in prayer the family of Chairman Mike Boyce. Certainly I think that was just a wake-up call to me about how just precious life is, and for us not to take any moment for granted, especially those that step up to not only take care of themselves and their family, but to take care of our community. So thank you, all of you. I hope that you have a great rest of your Friday and a wonderful weekend ahead. Take care.
Thank you.
Thank you.